Okay, so we are continuing from where we ended last week on first aid and disaster management. Last week we spoke about the introduction to first aid, and then we also did something on shock. This morning we are continuing with unconsciousness, and the school remains in Carroll School of Nursing. The name remains Benjamin Chiri Amba. Alright, so unconsciousness, as we've all heard before, is something we use a lot. You know, sometimes we use it correctly, sometimes we use it wrongly. And today we are coming to talk about it, and at the end of the day we would know how to use it in its appropriate context. Unconsciousness simply refers to loss of consciousness. So unconsciousness is loss of consciousness, and it can also be defined as a state of unawareness. A state of unawareness. So if someone is unconscious, the person is unaware of his or her immediate environment. There are three forms of unconsciousness that we would want to talk about, and it is usually categorized using a scale, whether the person is fully conscious to time, place, and person, or the person is fully conscious to only time and not place and person, or the person is conscious to place and not time and person, and the likes. So if someone is fully oriented to time, place, and person, the person is seen as someone who is fully conscious. If the person is aware or conscious of only time and person and not place, the person is seen to be semi-conscious. If the person is unaware of any of the three parameters, time, place, and person, the person is unconscious. And apart from that particular scale of orientation, we also have another scale that we use to assess someone who is unconscious, which we've all heard before on the word called the GCS chart, or the Glasgow Coma scale. The Glasgow Coma scale simply has three parameters. It has a lot of assessment tools on that particular form, but the main ones that we use in assessment of someone who is unconscious is the three main parameters, which is eye opening, motor response, and then verbal response. Eye opening is measured from 1 to 4, motor is measured from 1 to 6, and verbal is measured from 1 to 5. So none of them starts from 0. All of them starts from 1. Eye opening ends at 4, motor ends at 6, verbal ends at 5. So if you add 4, 6, and 5, you get 15. So the highest score someone can score for a GCS is 15, and the lowest someone can score for a GCS is 3. So if someone is scoring a GCS of 3 to 6, the person is unconscious. If someone scores GCS of 7 to 11, the person is semi-conscious. And if someone scores GCS of 12 to 15, the person is seen as conscious. We will go into details, and then we will also consider the practical aspect in the skills lab when we resume back to classroom. But in the interim, Glasgow Coma scale and the scale of disorientation are the two main skills that we will use in assessment of someone who is unconscious. What are the causes of unconsciousness? Unconsciousness can be caused by cerebral anemia. And when I say cerebral anemia, it's simply alteration in blood supply to the brain, resulting in lack of oxygen. So if someone is not having adequate hemoglobin, which carries oxygen to all parts of the body, including the brain, the person is likely to suffer some level of unconsciousness. And it happens a lot in people who who have had accident and have bled profusely. If someone bleeds profusely, the person is losing blood and losing hemoglobin as well. And low level of hemoglobin means that the person will have a deficiency of oxygen to the brain. And once that happens, there will be a stage where the person gets disoriented and we are going into unconsciousness. It's either the person is cerebrally anemic or the person is having structural deformity to the brain. So if a person is having structural deformity to the brain, that one is another cause of unconsciousness. Alright, so treatment of unconsciousness. These are general treatment of unconsciousness, and we will go into details, specifically what you would do for what condition when the person gets unconscious. So if the person, if someone falls unconscious, the first thing that you have to do after ruling out any spinal cord injury, in a case of an accident, if the person gets an accident and you do not suspect any spinal cord injury and yet the person is unconscious, you can sit the person down in a chair and put the head in between the knees. Why are you doing that? You are doing that to improve blood supply to the upper extremity. Or you will put the person down in a supine position and elevate the legs above the head. Why are you doing that? You are doing that to improve venous returns and also to improve blood supply to the lower extremity, including the brain. We also say that if there are onlookers around, especially in the case of accident, or if it's in the home setting where the person is medically ill and the person has fallen unconscious, you need to send onlookers aback or tell them to move back so that fresh air can circulate around the person for the person to be able to breathe. Or if it is in a room where the place is enclosed, you need to open windows to allow for fresh air so that the individual can breathe. You have to undo tight clothing, round neck, chest and waist so that the individual can breathe. So in the case of a man, you need to remove the belt if there is any. In the case of a woman and the person is wearing a tight clothing, you have to remove it so that it will allow for adequate breathing and circulation of air. If the patient or the victim has actually passed into a state of unconsciousness, place him in a prone position and undo tight clothing, as I've said earlier. Clear any saliva. You need to clear saliva from the mouth and make sure the mouth is well forward or the tongue is well forward. So you observe the nares, i.e. the nostrils, and you clear any foreign body that is blocking the nose. And also if there are secretions from the nose, you clean them with a clean material or a clean rounded material. And also you will also make sure you will pad the handle of a teaspoon or a tablespoon and then slot it in on the either right side or left side of the mouth so that it will fall on the tongue and propel the tongue forward so that it will not, the tongue will not fall on the respiratory pathway. You also have to send for medical aid. Once you do that, once you have been able to improve blood supply to the upper extremity and also you have been able to ensure patency of the airway, you look for means of transportation and send the person to the hospital. If the person is in respiratory distress after ensuring that the individual is having patent airway and yet the person is using the accessory muscles of respiration, you need to apply your artificial respiration as we discussed last week. Either mouth-to-mouth respiration, mouth-to-nose respiration, mouth-to-mouth and nose respiration. Either you use the Schaefer's method, mouth-to-mask, or Hodger-Nelson's method. Right. Fits and convulsions. Fits are sudden convulsive seizures with loss of consciousness. fits. So a fit is a sudden convulsive seizure with loss of consciousness. So we have to use the terms appropriately. We need to use the terms appropriately. The first condition that we will consider here is epilepsy. Epilepsy. With epilepsy, we have two kinds of epilepsy: petit mal epilepsy and grand mal epilepsy. The petit mal epilepsy is the minor one or the mild one, and it is characterized by periods of unconsciousness which may pass completely unnoticed. So usually, if you do not take care, if someone is having petit mal epilepsy, you may be living with the person, but you may not realize that the person is even having such a condition, because it is very, it occurs within a split second, very sudden, and then doesn't last for long. So you realize that the person will be sitting, there will be some state of unawareness. You'll be talking to the person doesn't mind you. If the person is holding a pen, the pen will fall down, and suddenly the person will come back to consciousness. And then when you try to ask the person what happened, the person may not be able to tell you what happened. But the person might have had the petit mal form of epilepsy and then has come back to normalcy. So the petit mal epilepsy is very, very immediate, transient, and it doesn't last for long. The person may appear momentarily very pale with a blank expression and may drop anything that may be held. But the period is so short that he may not fall down. So it's just that the person gets a distraction in attention. So if you are talking to the person seems not to respond to whatever you are saying, and then suddenly the person come back again. So if you are living with such a person, you think that the person is trying to be snobbish, but it may be something else. So the person sits down and there is a moment of silence. Suddenly, if the person is holding on to a plate of something, the person will just drop it and it breaks. And you'll be thinking the person is a destroyer. No, it might be the mild form of epilepsy that the person might be suffering from. We have the grand mal epilepsy. That one is very idiopathic and symptomatic. There is no evidence of the disease. It doesn't have any cause. The grand mal, it doesn't have a specific cause, and it is sometimes not symptomatic. But all you realize is that the person is having the crisis. Right. So we have four main stages of the grand mal epilepsy. We have the aura stage, we have the tonic stage, we have the clonic stage, and then we have the stage of coma. The aura stage is a warning stage where it lasts only few seconds and it may vary in character. Commonly, the person has an indescribable feeling in the stomach which rises to the throat, or the person may have particular taste in the mouth or have a sensation of smell. So it comes with a characteristic smell in the person's breath, and the person also feels some abdominal discomfort which is very indescribable, and that gives a sign that the person is about to have a grand mal form of epilepsy. Those who have had their crisis for a very long time, they've gotten the drift. So if they are about to have the crisis, they are able to notice. So as I've said, it lasts for some few seconds, and it comes with an indescribable feeling in the throat and also in the stomach, and it also comes with some characteristic smell in the breath of the individual. Right. And then we move on to the tonic stage. The tonic stage begins with sudden loss of consciousness. The person falls to the ground, make no attempt to save him or herself, and the muscles become rigid with the hands and feet clenched together. Breathing may become obstructed, and the tonic contraction of the respiratory muscles. It lasts few seconds. Inspiration may be stridulous, meaning may be noisy, give rise to so-called epileptic cry. So this is, the tonic phase is where the person falls down, making no attempt to save him or herself. So when it happens, the tonic stage, when it is happening, what you have to do as a first aider is that you have to send items or some dangerous items from the vicinity of the individual, so that the person may not hurt himself whilst trying to fall down or falling down. And also you need to let the person lie in a lateral position so that the individual may not have an obstruction with body fluids, saliva, or the individual can also breathe well, because it also comes with some respiratory distress, because the rigidity of the muscles also affect the respiratory pathway, and so the individual suffers some form of respiratory difficulties. So you need to put in interventions to enhance adequate breathing of the individual. Right, and then if you do not intervene with the difficulty in breathing, the face may appear cyanosed, and also veins become engorged due to inadequate supply of oxygen. Right. Now we move on to the tonic phase. The tonic phase is where the rigid muscles, which was in the tonic phase where the rigidity happened. In the clonic phase, the rigid muscles become relaxed and then contracts again rapidly, so that the whole body is convulsed with clonic twitching and jerking. So now the muscles that have become rigid gets relaxed, and then now the individual starts to jerk. The tongue may be bitten badly if you do not restrain the tongue or pad in between the teeth with a padded handle of tablespoon, or if you have a spatula, you can use a spatula. There may be incontinence of urine and feces. So if it happens, so you need to know that it is associated with the clonic phase, and you have to give the individual care accordingly, in case the person soils himself with urine or the person soils himself with stool. Then you have to also take note of the time that the chronic phase will last. So each of the phases you need to take note of the time. But actually, from the time that the crisis starts, from the aura sometimes may go unnoticed, but from the tonic through the clonic to the coma, and the time the person wakes up, you need to observe the time or the duration that the individual took for the whole episode to end. Coma is when the twitching ceases. The patient passes into coma, which usually lasts for approximately half an hour. The individual will sleep for about 30 minutes, deep sleeping for 30 minutes. During this period, the muscles relax, the color of the face returns to normal. The color of the face that became cyanosed returns to normal, and the breathing is stertorous for a time, and then gradually become quiet and normal. So breathing starts with stertorous breathing, that is noisy respiration, and then become normal subsequently. It becomes normal because whilst the individual gains consciousness, the individual is now able to swallow fluids that comes from the mouth, which will produce sound if the person is unable to swallow. The individual is able to control the tongue, and so the tongue doesn't fall on the airway to obstruct breathing. And also the muscles of the respiratory pathway become smooth, and so breathing also tends to be normal as it was before. So we have aura stage, tonic stage, clonic stage, and the stage of coma. Right. Treatment. We are talking about treatment for the various stages. So because aura usually go unnoticed, then sometimes you, the first aider, you may not be able to identify the aura because they are very, very symptomatic. Then the individual feels an indescribable feeling in the abdomen, an indescribable feeling in the throat, and then suddenly the person falls to the ground. So if the individual doesn't tell you how he feels, you may not be able to use your own eye or discretion to decide or determine whether the person is about to go into epileptic attack. So we will start from the treatment. We will start from tonic phase, where the individual falls to the ground and there is muscle rigidity. What are some of the things that you can do to help the individual come out of the tonic stage? If necessary, remove the patient to a safer surrounding. As I said earlier, you have to take all dangerous items that are likely to injure the individual from his or her vicinity. Lay patient flat on his or her back. Undo tight clothing around neck, chest, and waist. Clear away furniture or other equipment which may come into contact with the patient during the convulsive stage. Place a firm, well-padded article between the patient's teeth, but only if can be done easily before the muscle go into spasm. So you also have to make sure you have padded the in between the teeth, so that the padded handle of tablespoon will fall on the tongue and try to restrain the tongue from obstructing the airway or from even being bitten badly by the teeth. Then now we move on to the clonic phase. The clonic phase is when the muscle becomes relaxed and the individual starts jerking. So what are some of the things that you will do? When the twitching begins, do not try to restrain the victim. Sometimes some of our women will try to touch the individual, preventing the individual's muscles to stop jerking. At that point in time, the muscles cannot be stopped from jerking because it is coming from the brain. Physical strength cannot stop it. So you need to encourage, as a first aider, you need to encourage people who live with individuals with epilepsy not to restrict them from jerking when they are in the clonic stage, but rather give them support and protect the victim head from being injured. At the stage of coma, make the patient as comfortable as possible. Make the patient as comfortable as possible. Put them to bed or position comfortably as possible. Allow consciousness to return gradually. Allow consciousness to return gradually. Leave patient to lie quietly until consciousness return. If the patient is an adult and is the first seizure, medical aid should be obtained. Medical aid should be obtained. So one, make the patient as comfortable as possible, because it is the stage that the patient is coming to rest from all the muscle rigidity and all the muscle relaxing and jerking. The patient is coming to rest in the stage of coma. So you must make the patient very comfortable. Put the patient to bed and position the patient comfortably. Allow consciousness to return gradually. Don't interrupt the person's sleep or the person's sleep. Don't try to wake the person up. Allow the person to wake up him or herself. Leave the patient to lie quietly until consciousness return. If the patient is an adult and is the first seizure, medical aid should be obtained. So if the patient is an adult and is the first seizure, medical aid should be obtained. But if the person is a known epileptic patient or a patient living with epilepsy, then prescribed medications should be administered accordingly. Observations to do during fit. Observations to do during fit. Where the twitching started, so is the twitching the whole body, or where did it start from? Did it start from the head and finally go to all parts of the body, or it just started from all parts of the body right from the onset? So where it started from. Then what parts of the body were involved? Was it the whole body that was involved, or only the hand that was twitching? Or it started with the hand and it remained on the hand all through? Or it started with the leg and it remained on the leg all through? What parts of the body were involved? Duration of the fit. So you have to take note of the time frame that the seizure occurred, whether incontinence occurred or not. So the person had incontinence of urine or feces. Any particular attitude present, any particular attitude present. For example, twisting of the head to one side or another. So one side of the body was involved more than the other. So you have to take note of all of that. So if it was the head that was involved more than the legs, or the legs that was involved more than the head, or the upper extremities were involved more than the lower extremities, but the lower extremities were involved more than the upper, whichever way, you need to give a vivid observation on that. Now, convulsion. Let's move on to convulsion. Right. Convulsions usually occur in young children and are frequently termed infantile convulsion. The signs and symptoms resemble an epileptic fit, but the twitching are less severe. So the cause of infantile convulsion are many and varied, and some of the causes may be sudden onset of an infectious disease. So when there is an infectious disease, it can come with fever, and when poorly managed can complicate into convulsion. When the child is teething, when the child is having eruption of teeth, that one too, it comes with convulsion. When the child is experiencing constipation, it comes with convulsion. Or it comes with fever. When poorly managed, lead to convulsion. Presence of worms comes with fever. When poorly managed, can lead to convulsion. Same as gastrointestinal upsets. Treatment. There are two methods of treating convulsions. So the first method is the child can be put to bed and given the general care necessary for an unconscious person and protected during the convulsive period. Medical aid must be assessed. As an infantile convulsion is a signal for series of underlying conditions. So if there is any medical condition, it has to be assessed to ascertain which of the medical conditions is the underlying factor for the convulsion. The patients are usually alarmed and must be reassured. So the patients, including the relatives, must be prepared psychologically to face the condition. Keep them busy by asking them to contact their own doctor, prepare the child's bed, and so on. So you need to keep them busy by way of diversional therapy so that they don't get so much anxious. The second method of convulsion, so the first one basically is finding the underlying disease that is causing the convulsion. The second one is the child may be undressed, placed in a tepid water for approximately 10 to 15 minutes. Cold compress may be applied to the head. When twitching subsides or ceases, remove the child from the bath, dry the child in a night dress, reassure parents and arrange for medical aid. So the first one, you are finding out the underlying disease. For example, if it is malaria, you give the child antimalarials. And once antimalarials are given, fever will be reduced and convulsion will be resolved. If it is gastrointestinal upset, and then a gastrointestinal upset is found out as the cause or the underlying factor to the convulsion, gastrointestinal upset is treated, and then the fever is resolved, and the individual doesn't go into convulsion. So it is not necessarily giving anticonvulsants when an individual is having convulsion, but also finding out the underlying factor or the underlying disease that is predisposing the person to convulsion, and then treat it accordingly. Again, the second method is that you will undress the person and put the person in a tepid water. Try to tepid the person and cool the temperature down, and you apply cold compress to the head, and also when the twitching subsides, you dress the person in the pajamas, give the person a comfortable rest, and then you reassure patients and relatives, and if necessary, send for medical aid. So now let's talk about diabetes. We are talking about diabetes not as a condition, but we are talking about diabetes and looking at some of the unconsciousness diabetes present. So far as unconsciousness is concerned, and mark and take note of what I am saying, so far as unconsciousness is concerned, we have two forms of diabetes. we don't have only two forms of diabetes. We have two forms of diabetes so far as unconsciousness is concerned. So we have diabetic coma, and then we have insulin coma. Diabetic coma refers to hyperglycemic coma, when there is high levels of glucose in the blood leading to coma. That is diabetic coma. It occurs when there is an excessive increase in the amount of glucose in the blood with presence of ketones in the breath and in the urine. That results in diabetic coma. Why will there be increase in glucose in the blood, and yet the person is having presence of ketones? Why? Because it is when the body doesn't have adequate glucose, that is when the body, by way of gluconeogenesis, uses body fats to get glucose, and the end product is ketones. In that situation, you know that the body is lacking glucose. But why would the blood be having high level of glucose in it, and yet there is a high level of ketones, and suddenly the person go into diabetic coma? The reason is that the glucose is not supposed to be in the blood. The glucose is supposed to be carried out to cells, tissues, for usage by the hormone insulin. But due to low level of insulin in the blood, or insulin insensitivity in the blood, depending on the kind of diabetes the individual is suffering from, insulin is unable to take glucose from the blood to the cells that needs the glucose. And so the glucose continues to remain in the blood, and then now the cells also initiate the process of gluconeogenesis, using fats stored in the muscles to derive glucose for its usage, thereby leaving ketones in the muscles, blood glucose being higher, and now subsequently the person goes into unconsciousness. How will the person go into unconsciousness? The person will go into unconsciousness because the blood glucose and then the ketones in the blood will cross the blood-brain barrier and go into the brain, causing disorientation to the individual, and now the individual losing its sense of consciousness. So that is what happens in diabetes coma. The signs of diabetes coma is the onset is usually with headache. The onset comes with headache, restlessness, and drowsiness. It comes with headache, restlessness, and drowsiness. Headache because it is as a result of tension, headache, because the individual is having excess glucose in the blood, and yet the cells are dying of glucose. It presents itself in a form of tension headache, where the individual's nerves will be excited. There will be excitability of the nerves, which in a long run presents itself as headache. Someone who is having headache cannot rest, so there will be restlessness. And then because ketones have gone into the brain, the individual will look drowsy, as if someone who has drunk alcohol. The patient may complain of abdominal pain. So there is abdominal pain. And with the abdominal pain, it presents itself in a very funny way. It is very localized, as if the person is having ulcer in that manner. The respirations are deep and sighing with diabetes coma. The respiration is deep and sighing, but the skin is dry. The skin is dry because, glucose is water-loving. Glucose is hydrophilic. Wherever glucose is, it draws water to itself. So high level of glucose in the blood means it will withdraw fluid from the interstitial spaces into the vessels, increasing blood volume, and also rendering the muscles and the skin dry, and rather increasing blood volume. There is smell of new mown hay or nail varnish from the breath. So when the individual breathes, there is a smell of acetone in the person's breath. If you do not know acetone, when you are passing and then someone is mowing grass, the grass that the person may be mowing, it comes with a characteristic odor from the grass. That characteristic odor looks like that of acetone, and that is the kind of smell that you will get from someone who is having diabetic coma or diabetes coma. And then suddenly there is eventual unconsciousness. What is the treatment that you will give to someone who is having diabetes coma? If it is known that the person is diabetic and the above signs and symptoms are recognized before unconsciousness occurs, the only treatment is to give insulin. The treatment for diabetes coma is administration of insulin. This is difficult to do as a first measure, as insulin must be administered correctly. So if you do not know the proper or the accurate dose of insulin that you have to give to the person, you will not be able to give the insulin at all. But you have to note that people who have diabetes are usually given some diabetes card that come with their dose of insulin that they are supposed to take. So if someone falls unconsciousness, especially in a public place, and the person is having a handbag, you can go into the handbag and look for the diabetes card. If the person has an insulin in the bag and a diabetes card, you just look on the diabetes card, get to know the dose of the insulin, and then with the insulin in the bag, you just give a shot to the person. And then the person come out of the coma. That is when you have assessed using the signs and symptoms to ascertain whether what is happening to the person is diabetes coma or not. Meanwhile, get patient to lie down until doctor arrives and reassure any relative. Transport patient to a nearby hospital for medical aid. So with the treatment of diabetes coma, all that you need to do, the most important is insulin administration. However, if there is no presence of insulin, or there is no diabetes card available to know the dose of insulin to give to the person, then you do not have any choice than to send the person for medical aid, or send a person to a nearby hospital for medical aid. And whilst you are doing that, you need to assess the person for respiratory difficulties, because you have said that someone with diabetes coma is likely to have deep respirations, which are or can be sighing. Now let's move on to insulin coma. Insulin coma is one of the deadly forms of coma so far as diabetes is concerned. And insulin coma is also referred, is in other words called hypoglycemic coma. Just we said that diabetes coma is called hyperglycemic coma. Insulin coma is hypoglycemic coma, and it occurs when insulin is given overdose, or when an individual takes insulin and misses a meal. So in effect, insulin is in the body and there is no sugar or glucose to act on the insulin. So insulin coma is the opposite of diabetes coma. With diabetes coma, there is presence of glucose in the blood, no insulin to carry the glucose, and so the person go into unconsciousness. And with insulin coma, there is presence of insulin, no sugar to pick, or for the insulin to pick them back to the muscles, and so there is insulin coma. So that is the concept. With diabetes coma, high level of glucose in the blood, little or no insulin to carry them to the muscles. With the insulin coma, high level of insulin in the blood, little or no glucose to be carried to the muscles. So the signs and symptoms of insulin coma. The onset is sudden with giddiness, faintness, and confusion. The respiration in this case is not deep and sighing, it is quiet and shallow. Quiet and shallow. The skin is moist. The skin is moist. Why would the skin be moist? The skin will be moist because glucose will be very, very low in the blood and high in the muscles. So water will move, or fluids will move from the vessels to the muscles by osmosis. Low concentrated region to a higher concentrated region, rendering the muscle and the skin very wet, unlike in diabetes coma. The hands and legs become shaky. The hands and legs become shaky because the individual is lacking glucose and rather having adequate insulin or even overdose of insulin. There could be eventual unconsciousness. The patient may appear to be under the influence of alcohol. Treatment of insulin coma. If condition is recognized before the individual becomes unconscious, she should be persuaded to take about 2 teaspoonfuls of sugar, either dry or in drink immediately. So usually what we usually recommend as first aiders is taking Sprite. When someone has taken insulin and hasn't eaten and the person is going into coma, you hurriedly assess the person's level of consciousness, and if the person is semi-conscious to conscious and the person has a good swallowing reflex such that if you pour the spirit in the person's mouth, it will not go into the respiratory pathway, then you give the person Sprite to drink. Sprite, which contains some sugar. So you give the person Sprite to drink, or even some sugar cubes in water, so that the person will be taking sips of it. There is usually little time between the appearance of mental confusion and unconsciousness. After a certain point, the patient may refuse to cooperate. He should take sugar again in about 10 minutes if symptoms still persist. So if you give the person sugar cubes and symptoms still persist, you can give the person more of the sugar. Diabetic patients usually carry some sugar with them to take at the slightest test sign of insulin reaction, as most diabetics recognize signs and symptoms of the overdose. So if the person, some of them too, they know they've had the condition for a very long period of time, so they are able to know the dynamics of the condition. So if they are about to go into insulin coma, diabetes coma, they are able to notice it, and so they take measures against it appropriately. So most of them carry sugar along. So when they have taken an insulin shot and they start having the signs and symptoms, they hurriedly take a sugar cube. When the symptoms still persist, they will take another, and then they are fine. So that is what you have to be doing for someone who have had insulin coma. Then you have to send the individual to the hospital. Now, Uraemia. Uraemia can also present itself in unconsciousness. It is a term applied to combination liable to occur in the kidney, as the term suggests large amount of waste product, urea, that accumulates in the blood. So Uraemia is accumulation of urea in the blood. So ura is refers to urea, And then aemia is blood, so urea in the blood, accumulation of urea in the blood, and it is as a result of malfunctioning of the kidney. Urea is an unwanted product of digestion, and it has to be taken from the blood by the kidney. So if for some reasons the kidney is malfunctioning, urea continues to remain in the blood, and then it goes into the brain and renders the individual unconscious. Signs and symptoms. Signs and symptoms of Uraemia include drowsiness with headache. Vomiting may be present. Convulsions usually occur and may resemble an epileptic fit. Person become unconscious with distressed respiration. Treatment. Treat fever when necessary to avoid convulsion. You treat fever when necessary to avoid. So if the Uraemia presents itself with fever, you need to manage the fever so that it doesn't go into convulsion. And then you have to send the person for medical aid immediately. Put the person in a dark room, because the Uraemia also, one of the signs and symptoms is photophobia. So you need to put the individual in a dark room and keep the person warm and then quiet until doctor arrives. If the doctor delays, you send the individual to the hospital. Now let's talk about cerebrovascular accident, CVA. These terms are used to describe a condition of unconsciousness which occur quite suddenly, usually in elderly people. When the blood vessel bursts and there is hemorrhage into the substance of the brain, it results into cerebrovascular accident. So there are two forms of stroke. We have hemorrhagic stroke and we have ischemic stroke. So the hemorrhagic one is when there is a burst of a vessel, a cerebral artery, supplying blood to the brain, burst. And due to the leak out of blood that should have gone into the brain, then there's a leak out. It leads to cell death of the brain, and for that matter, some paralysis occurs. And ischemia is also when there is an obvious occlusion of a cerebral artery, inhibiting blood supply to a portion of the brain, and also resulting into some form of paralysis, which we are calling ischemic stroke. So we have two types, ischemic stroke and then hemorrhagic stroke. Signs and symptoms of there may be one or more prodromal features just before the attack, including headache, giddiness, faintness, noise or drumming in the ear, and heaviness in the head. Patient suddenly becomes unconscious. Face appear flashy and temperature elevated. I have told you that the temperature controlling center is on the brain. So sometimes when something happens to the brain, the body's ability to control the body's temperature is lost. And so there will be a high likelihood, or there will be a likelihood of temperature elevation. Pulse will be slow and bounding. Respiration will be noisy and stertorous. There may be paralysis of one or both sides of the body. Treatment of CVA. Minimize handling patients as much as possible. If sufficient people are unavailable to lift up the patient, leave the patient at where he or she fell. Do so by keeping harm from vicinity. Raise head and shoulder slightly, supporting the head by a pillow. Remove any dentures and keep mouth clear of saliva. And then it may be necessary to keep the patient warm, and if outside, place a blanket below and one over the patient. Arrange for transport to hospital as quickly as possible. Right. So in absence of further questions, we will continue with poisoning. Okay, so poisoning. Poison is a substance which injures or destroys tissues when introduced into the body or applied externally. It's either introduced into the body or applied externally. It causes injury to the cells of your body. That is poison. There are three common causes of poisoning. One of them is by eating contaminated food. Committing suicide by killing yourself, or killing someone else, murder. So that is poisoning. So with the eating of contaminated food, by eating contaminated food, poison food or fungus, by drinking contaminated water, drinking poisonous liquid from a wrongly labeled bottle. So for example, someone fills methylated spirit in a Voltic bottle. You didn't know, you thought it's water, and then you drank some and realized, no, this is not water. Poisoning. By accidentally taking overdose of medicine or sleeping tablet, that one too is poisoning. Committing suicide, an attempted suicide should be suspected if apparently healthy man is found suddenly ill and still conscious but making no effort to obtain help. So if a healthy man suddenly falls ill and is making no effort of saving himself, you realize that this man is having wrong motives and is wanting to kill himself. So you need to go to the person's aid. Usually there has to be a history of depression and stress to commit suicide, especially when something bad has happened to the person and the person is depressed and the person is likely to have suicidal tendencies. Murder may be carried out by one introducing poison into another person's food or drink. It may be done in a large dose or repeated small dose. So if someone put poison in another person's food or drink, trying to end the person's life, that one too is murder, and it's one of the ways of poisoning. Classification of poison. We have irritant poisons, we have narcotic poisons, we have corrosive poisons. So 3 of them that we will consider under this particular enterprise. So irritant poison act on the alimentary canal, causing irritation and inflammation. It acts on the alimentary canal, causing irritation and inflammation. And common causes of irritant poisons are, basically the ones that act on our digestive system, digestive tract. Contaminated, for example, contaminated tin food or fish and meat paste, poisonous berries or fungi, chemical substances, for example, arsenic, mercury, and the likes. Narcotic poison. Narcotic poison acts on the nervous system. Narcotic poisons act on the nervous system. The effect of narcotic poison, they act as hypnotics. That is, it induces sleep. And then they act as deliriant. It causes confusion. And they act as convulsants. It causes convulsion. Corrosive poisons act on the digestive system, and it also corrodes wherever it finds itself. It could be acid or alkaline. Aims of first aid treatment in poison. Aims of first aid treatment in poisoning. The first aim of first aid treatment in poisoning is to counteract the effect of the poison. Counteract the effect of the poison. So you counteract the effect of the poison. So if it is an alkaline, you give acid to counteract the effect of the alkaline. Or if it is an acid, you use an alkaline to counteract the effect of the acid. And then you send to the medical aid, which is also one of the aims. You arrange for transport as quickly as possible. You identify the poison or containers, medicine bottles, empty glasses, or remains of food should be kept for inspection. Any vomit, urine, or feces should be kept for medical inspection. Any vomit, feces should be kept for medical inspection. If death occurs, the police must be informed that nothing in the vicinity should be touched or removed until their arrival. Chemicals to counteract the effects of poisoning. So we are looking at the chemicals, that counteracts the effects of poison. The first one is emetics. And emetics are substances that induces vomiting. Example is salt and water. 2 tablespoons of salt dissolving in water should be followed by large draught of tepid water. It is given to induce vomiting. Several tumblerful of tepid water. This may be followed by irritation of the throat using your hand to induce vomiting. So you take in the salty water and then you use your hand to induce vomiting. That is also a way of inducing vomiting, emetic. Antidotes. So antidote, they are substances which neutralizes or counteract the effect of a poison. So if the person was poisoned with an acid, an alkaline drink may be given. For a typical example of an alkaline drink is bicarbonate soda. And if the person was poisoned with an alkaline, you can use an acid, which is a weak acid. Or the popular one is the one that we know is a cup of vinegar can be given to the individual. Appearance. Appearance are substances that remove traces of poison in the intestine. So if someone takes in poison and some travels into the intestines, after an antidote is given to counteract the effect of the poison in the gastric chamber, the stomach, the remaining that traveled into the intestine is removed or are removed using appearance. The appearance are used to remove traces of poison from that pass into the intestines. Example is castor oil and the likes. We also have demulcents. Demulcents soothes irritated mucous membranes. It soothes irritated mucous membrane. A typical example is milk, olive oil, paraffin oil, and the likes. So when you take in a corrosive poison and then it irritates your throat, the most appropriate chemical to counteract the effect of the irritated throat is a demulcent. A demulcent is used to counteract the effect of a corrosive poison in the throat. And a typical example is milk, paraffin oil, or liquid paraffin, and olive oil. Irritant poisoning. Signs and symptoms of irritant poisoning. How would you know that the poison that this person was giving was an irritant one, or was a narcotic one, or was a corrosive one? So, signs and symptoms of irritant poisoning. First example is, or the first one is nausea. We have vomiting. Why is there nausea and vomiting? Because we have told you that irritant poisons act on the alimentary canal. So when we talk about nausea, we talk about vomiting, which is all activities of the alimentary canal. Acute abdominal pain, still on the GIT. Diarrhea, still on the GIT. Faintness and shock and great prostration. So pain beyond management, the person now assumes great prostration and now eventual unconsciousness. If the irritant poison travels into the blood, the person will go unconscious. Treatment, give an emetic to induce the vomiting. Then after you have given an emetic to induce vomiting, give demulcent. The demulcent will soothe the mucous membrane of the alimentary canal. 10 minutes after vomiting has ceased, give an apparent, which I have said, example is castor oil. It will go and remove the remnants of poison from the intestines. Treat for shock if present, and then send for medical aid. If it is known that what actual poison it is, an antidote can be given to also help in the treatment. Narcotic poisoning. Right. So with narcotic poison, signs and symptoms of hypnotic poisoning. Under narcotic, we have hypnotics, we have deliriants, we have convulsions. So the signs and symptoms of hypnotic poisoning is drowsiness, slow respiration. The individual breathes at a slower pace and the pulse is very feeble. Pinpoint pupils, coma and subsequent death. Treatment: if the person is still conscious although drowsy, try to keep them awake by making him walk about. The reason is that you do not want the person to go into unconsciousness. So if the person is conscious, you try to keep the person active in order to not to go into unconsciousness. Prepare and give an emetic as quickly as possible and repeat the emetic at an interval if necessary. After vomiting, give a stimulant in the form of strong black coffee. An aperient should also be given. If patient remains unconscious, transport to hospital. Still on narcotic poisoning, we have signs and symptoms of deliriant. The deliriant causes dryness of the mouth, thirst, dilated pupils, unsteadiness, delirium, which is confusion, and then eventual coma. The treatment is that you give an emetic to induce vomiting. After vomiting, give strong tea or coffee. Send for medical aid by arranging for transport. Signs and symptoms of convulsant poison. Some of the signs and symptoms are anxiousness, feeling of suffocation, twitching of muscles. Treatment include, if possible, give an emetic. After vomiting, give strong tea. Send for medical aid. If breathing ceases, apply artificial respiration. Corrosive poisoning. With corrosive poisoning, we have the signs and symptoms are severe burns. We have told you that wherever it finds itself, corrosive poison, wherever it finds itself, it corrodes wherever it finds itself. So there is severe burns around mouth and lips, especially when it is acid or base. There is severe burns. Difficulty in speaking because the throat is bent, and so the speaking becomes problematic. Severe pain in the mouth, throat, chest, abdomen, everywhere is bent. So there is severe pain all along the digestive tract. There may be nausea and vomiting, and there may be shock. Do not give an emetic, as mucous membrane will burn when victim vomit. Why will it burn when victim vomit? The content of the stomach is also acidic. So if the esophagus, up the throat is bent, and the individual is vomiting again, through the same pathway that is bent, and then the content that is being vomited out also contains acid, you can only imagine, it will cause severe pain. Right, so you don't give an emetic to induce vomiting, but rather give an antidote. If it is known that the individual took an acid or an alkaline, you give the opposite of whichever poisoning the person to. If an acid, give an alkaline. If an alkaline, give an acid as an antidote. Give a demulcent to soothe mucous membrane or bent mucous membrane or damaged mucous membrane. Treat for shock if present. Send for medical aid. Now, carbolic and Lysol poisoning. The action of carbolic and Lysol is slightly different from that of other corrosive. They harden as well as bend the mucous membrane. Signs and symptoms of carbolic and Lysol poisoning is burning sensation in the mouth, throat, and abdomen, pain in the mouth, throat, and abdomen. There may or may not be vomiting. Breath possess characteristic odor of the poison, and then the lips corners are also stained. The inside of the cheeks and gum will appear white in color. Severe shock will be present. So treatment: give an emetic to induce the vomiting, followed by liquid paraffin as an antidote. Give liquid paraffin also to act as demulcent. If liquid paraffin is not available, 1 tablespoon of Epsom salt in a glass of milk can be given, and treat for shock if present. Send for medical aid appropriately. So now we are done with poisons, and so we move on to bites, stings, foreign bodies, and sunburns. Bites, stings, foreign bodies, and sunburns. So under bites, we are first looking at, firstly we are looking at dog bites. Dog bite. A dog bite is also a punctured wound. It's a punctured wound, and maybe deeply and maybe deceptively deep. Punctured wounds are very deceptive. On the outside, it is less extensive. On the inside, it is very, very extensive. So when you look on the outside, you could see only the teeth, the opening that the teeth left on the skin. That is the only thing that you will see. But inside, the teeth went deeper, and so that is the nature of punctured wound so far as dog bite is concerned. Treatment of dog bites: you keep the part low. So if the the dog bites the leg, you keep the leg low, not high above the head. Neither will you keep the hand high above the head, but you keep it low so that it will bleed out. The poison will bleed out with the blood, or will come out with the blood. Wash wound thoroughly with warm water or a solution of potassium permanganate crystal if solution is pink in color. Tie a constriction round the limb. So if the individual bites here, you tie up and down. If the individual bites here, you tie up and down so that the poison will be restricted to that localized area only. Transport the patient to the hospital, send for medical aid. If it is possible at all that the dog has rabies, you have to cage the dog and inspect the dog or observe the dog for some weeks. Snake bites. The danger of snake bite is absorption of a poison known as snake venom. Affected area becomes swollen, painful, and bruised. Nausea and vomiting, difficulty in breathing. In severe cases, collapse, paralysis, and convulsion. Poisonous snakes leave marks of 2 fangs, whereas non-poisonous snakes leave the mark of 2 rows of teeth, not fangs. So, for you to know the difference between a poisonous snake and a non-poisonous snake, poisonous snakes leave their fang. When they bite, they leave some membrane of the teeth inside of the area bitten. But non-poisonous snakes, they do not leave anything. It is just the roll of the teeth, that is left on your skin. It doesn't leave the fangs in on your skin. Treatment: keep the victim as still as possible and do not move the part that has been bitten, because the more you move, the more it gets moving into the blood. Tie a constriction around the limb above and below. And then if there is no hospital nearby, and if you were with the victim at the time he was bitten or soon afterwards, an incision can be made to remove the poison. Keep patient calm and reassure him that a small portion of snake bites, even from poisonous snakes, prove fatal. Very few snakes inject full dose of poison. If the snake was killed, take it to the hospital so that a suitable antivenom can be identified. Taking the snake to the hospital doesn't mean that when you get to the hospital, you go and put the snake on the nurse's table and tell them that this is the snake that bit the patient. Rather, you tie the snake in a nice polythene bag, leave the snake outside of the hospital, maybe some few distance to the hospital gate, and then tell the healthcare provider that the snake that bit the individual, you were able to kill it and you have brought to the hospital. If the individual opt to have a look at the snake, you walk the person out of the hospital gate, and then you show the snake to the person. But you don't take the snake to where the people are. You will scare them away from even attending to your own patient. Get patient to the hospital as quickly as possible. We have stings. Stings are caused by scorpions, spiders, and insects. Stings in themselves are not serious, but some react violently to them. This reaction is due to the person being hypersensitive to the sting, which acts as a foreign body. Treatment of a bee sting. The bee usually leaves its sting within the wound, and this acts as foreign body and must be removed immediately. Of course, when the bee leaves its sting as a foreign body in your body, there is process of inflammation that happens, and so the sting that is left in your body comes with inflammation, and the individual, the area or whichever area that the sting is, will experience all the clinical signs and symptoms of inflammation. Bath the area thoroughly with weak ammonia solution, and then the intention is that it will reduce the efficacy of the sting that the bee might have introduced into your body. And also you give an antihistamine cream that will also reduce the reaction of the sting that the bee might have introduced into your body. If general symptoms develop, such as headache, severe swelling of the affected part, you can send for medical aid. Foreign bodies in the eye. Foreign bodies in the eye. This is fairly common occurrence and it's extremely painful. The danger of a foreign body in the eye is that they may become embedded in the conjunctiva and subsequently damage the cornea. So common foreign bodies entering the eye are dust, grit, sand, insects, and minute pieces of metal. Signs and symptoms of foreign body in the eye. It includes pain in the eye, redness, and watery eyes. So you examine the eye from the inner canthus to the outer canthus. So you let the person look into the inner canthus while you observe the outside, and then now the person look outer canthus while you observe the inside or the inner canthus. So a thorough examination of the eye is necessary to locate the foreign body. Place the person in a chair near a window, ensuring a good light. Tilt the head backward, supporting it with a cushion or pillow. The foreign body may be present inside the lower or upper lid, or actually in front of the eyeball. Instruct the person to look forward using the thumb index finger. Pull the lower lid in downward, drawing it away from the eyeball, exposing the inner surface. So when you were a kid, you try to do kakai just that way, like that. You turn the eyelid outward so that you may be able to observe for presence of foreign body on the eye. So to remove foreign body to both eyes, damping a piece of cotton. Damping a piece of cotton wool or twirled up corner or of a clean handkerchief and touch the foreign body. Then the foreign body will adhere to the damping cotton or handkerchief. After removal of foreign body, soothe the eye by instilling 1 or 2 drops of olive oil or paraffin oil. Now, foreign body in the ear. Foreign body in the ear. Children frequently insert beads, buttons, pebbles, or berries into the ear. Insects may also penetrate into the auditory canal. If the object is not protruding, prevent child from poking the ear. So when something enters into the child ear, you prevent the child from poking. Poking is trying to remove the thing. Place a pad over the ear and bandage lightly in position. So if you don't want the child to put their hand inside the ear, you cover it with cotton, bandage it lightly so that it will prevent them from taking their hand there. Take the child to a doctor or an outpatient department of a hospital for it to be removed. If the object can be clearly seen and is protruding, remove it gently with a pair of tweezers. So if it can be visibly seen, then you can remove it with a pair of tweezers. If you have the pair of tweezers, you can, or if you don't have, you can improvise. If an insect has entered the ear, attempt to float it out by pouring few drops of olive oil, castor oil, or paraffin oil into the auditory canal. Sometimes insect can enter into the ear and it will not even die. It will still be live inside the ear. So for you to kill that insect inside, you need to drown it in oil. So you pour oil in the ear. Once oil enters into the ear, it will prevent oxygen or air from entering the ear, and then the insect will suffocate and die. So again, if you put paraffin oil in the ear, you are killing the insect and also creating a soothing atmosphere or medium in the ear so that it will lessen the pain that the individual may be having. Foreign bodies in the nose. Again, if foreign body enter into a child's nose, you do not make any attempt to remove it. Some of the children, you tell them to blow their nose, try to bring the thing out, and then when you tell them blow it out, they are doing. So by the time you realize, they might have inhaled the thing deeper, and then it has even gone into the respiratory tract much more deeper. So you make no attempt to remove it. Close the unaffected nostril and tell the child to blow the nose through the affected. Do not let the child poke the nose and do not try to remove the foreign body. If blowing the nose does not dislodge or remove the body, send child to the hospital. Sunburns. So sunburns is excessive exposure to sand may cause quite serious burning of the skin. Fair-skinned people are much more susceptible to sunburns than dark-skinned people. The only reason is melanin, because dark people have a lot of melanin on their skin, and light-skinned people have some melanin, but not many. So dark people are able to withstand sun than people who are light-skinned. The actual burning of the skin may be accompanied by headache, dizziness, irritation, pyrexia. If fair-skinned people are exposed to sun, they may protect themselves by applying one of the many types of protective lotion. If the skin does not become red painful, the pain can be relieved by application of calamine lotion. So if someone experiences sunburns, one of the lotions that the person can apply is calamine lotion, the one that is used in chicken pox, also called samantifie. That is one of the lotions that the individual can use in case of sunburns. Right. So all questions will be taken when we are back to classroom. I entreat you all to keep reading your slides and watching the video and paying attention to whatever has been said, and bring your questions for answers when we are back to classroom, because when we resume, we will not waste much time in having our mid-semesters and end of semester rolled out. I wish you all well. Thank you.